One of the questions that I get a lot from patients is ice or heat, and you may know this already, and I'll give you some other information about how to deal with pain. But, pain itself, you shouldn't just ignore. The first thing is, like, if your body is giving you some pain, then it's telling you something. So if you can get out of pain by getting at the root of the issue, that's the most important thing. But in the meantime, how do you deal with pain? Because pain itself is a stress on your body. So ice and heat will interrupt the pain signal to your brain because the temperature signal kind of trumps the pain signal. So ice or heat will interrupt pain signal and both will feel better. And there is some controversy about using ice and heat. Ice will drop the inflammation very quickly, but then if you use too much ice, it'll cause inflammation. So ice has its place. You don't use ice more than 10 minutes a day. And it shouldn't be ice. It should be like cold I'm talking about, not literal ice on your skin that would, damage the tissue. Heat, the use of heat is more to kind of bring blood to the area and to soften soft tissues, to soften the muscles. If you have hard muscles, if you have trigger points, a trigger point needs some blood flow. So, the knots in your traps, that's kind of like, those are trigger points. So heat, 10 minutes a day, that's fine. Moist heat will penetrate the muscles better, but too much heat will cause inflammation. So you don't want to overdo heat or ice. Both will interrupt the pain signal going to your brain, but too much of either will cause inflammation. So other ways to deal with pain. So some of the other options other than taking NSAIDs, Tylenol is not an NSAID. It doesn't take care of inflammation. It interrupts the pain signal going to your brain, but it has a lot of downsides, including, some negative effects on your liver. So I think Tylenol should be taken off the market. I think it's a terrible drug. However, you need to, take care of pain. Pain itself is a stress on your system. So Motrin, other types of NSAIDs, that's fine, but you don't want to overdo them. They all have side effects. A topical anti-inflammatory can be safer. One of the safest ways to deal with pain is homeopathy, which really has no side effects. You can use topical arnica gel, which is an anti-inflammatory, and you can slather it on several times a day. I learned about arnica gel from patients who had arthritis and found it to be highly effective at managing their pain of arthritis. So arnica gel, and there's different brands out there. It's highly available, CVS and Walgreens, wherever. Another is if arnica gel isn't doing for you, is Voltaren. Voltaren used to be a prescription drug, and now there's an over-the-counter version that's a lower dosage, but that's a highly effective anti-inflammatory too. That's more topical. Topical isn't going to go systemic, although it is going to be absorbed into your system, but at least it's not like going through your digestive system and affecting all of your organs. So I hope that helps. And if you have any questions, you can always book an appointment for me. That I'm always looking for the underlying issues. What are the roots of your pain? That's where chiropractic comes in. And if it's not me, then I can refer you to an appropriate doctor that can take care of your pain issues. I don't always take care of everything as a chiropractor. Sometimes I refer to pain management doctors or orthopedists, and I believe in using the least invasive thing possible that gets the job done. So you might not want to start with surgery, but might want to start with chiropractic and see if that can get to the underlying issues. All right, have a great day. Love you all. Bye-bye.